Hi, everyone. I'm Camellia, an APRN, a psychiatric mental health nurse practitioner, also known as a PMHNP, and I am a nursing and mental health enthusiast. And I know it's been a little bit since I actually did a video, and thank you guys that have continued to watch, have continued to engage here. Thanks to the new subscribers. If you're new here, thanks for subscribing and thanks for watching. Today, I actually don't want to really talk about anything particularly new, but I do want to expound upon some content that I talked about almost a year and a half ago. And that video was titled Four Questions to Ask Before Pursuing Your Distance Education Program. And that video was done um, a while ago, and it was really meant to talk through some of the things that you should consider if you are preparing to advance your degree, you're considering selection of programs. And so I did talk more specifically about the distance education side of it. I also talked more specifically about some of the personal things to consider if you are planning to pursue distance education and advance your nursing degree. So I sort of want to expound upon that a little bit today, but I think this information is still relevant. It's sort of a timeless theme because we always have those of you who are possibly seeking to advance your degree. And I've gotten a couple of messages from some that have actually recently applied and are now waiting for the decision on acceptance into their programs. So I think this is timely information, which is why I wanted to bring it up now. And I really want to focus in on a specific question as we're going through this that I get often. And that question is, does my nursing school or nursing program matter? And I really want to focus in, like I said, on things to look for when you are selecting those programs or looking through and teasing out which may be most appropriate for you. Okay. So I do want to first state that all nursing programs are not created equal. Now, unfortunately, there are some that have been deemed low quality, and hopefully, we'll get to a point where everyone's sort of on the same standard in terms of academics and requirements and rigor. But there are some that are not great. So I want to say, just to say, do your due diligence on this because all programs are not created equal. Okay. Really, you want to also think about this from the perspective of setting you up for success as a student, because you are going to be expected to practice and function autonomously, regardless of whether you have a supervising physician or not in your state. The PMHNP role is an autonomous role. You are going to be expected to practice as such, and so you really want to be prepared. And most of that has to do with the preparation with your program and your clinical practicums. Okay. This is also probably a harder decision than before, harder than when I actually kind of sought things out about 5 years ago. Or a little bit before 5 years ago. My program was 2 years. So it's more probably a little harder and more challenging because there are so many more programs now to actually think through and sift through. And so I just want to highlight about 5 different areas that you want to be exploring when you are going through this process of determining which program may be right for you. Okay. So the first one is just really focusing in on the admissions aspect of it. Be sure that you're familiar with the criteria. Be sure that there is some rigor that you can really glean from the process. Why is that important? As I mentioned in a previous video, it's important because you don't want to attend a program that is not meeting scholarly standards. And many times that can be really reflected in the admissions process. So if a program is accepting everyone, there's not a lot for you to do and to show in terms of your experience, in terms of, you know, everything that it takes for this role, then I would say that that's probably not the best quality program. And so you really want to think about that in terms of admissions. Okay. Number two is actually curriculum. I did a video a couple of weeks ago about the ANCC criteria because as a PMHNP, that is the only entity, the only accreditation body for the PMHNP board certification exam. And so that's important because you have to be sure that your program aligns with the specific criteria of the ANCC. You can go to that website and look and see exactly what is going to be required because you are going to have to prove all of these things before you're able to sit for your board examination. Okay, so be sure that you are meeting the criteria for the ANCC specifically and that your program also meets that criteria. Okay. Number three is accreditation. Of course, this should be going without saying, but unfortunately, there may be some programs still out there that are not, their accreditation is not based on the standards of the ANCC. Okay, so again, I would refer you back to the ANCC's website so that you get a very good picture and idea of what is expected, and that does include the accreditation criteria and what your program has to actually cover in terms of accreditation. Okay. So that's number three. Number four is sort of a twofold thing here. The first is consider what the attrition rate is for the program. I really am a fan of going ahead and talking to students that have already pursued the route. You can join groups on social media sites for this, but it gives you an idea of how many students are hanging on, if there are particular structural issues, issues around academic scholar that could be impacting the attrition rate for students. So you want to really pay attention to that, which programs are holding on to students throughout the entire program. That doesn't mean there won't be outliers where some people, may drop out or students may drop out for certain reasons, but the attrition rate should really you should have people that are continuing the program for the most part. Okay, so get a good idea of that. You also want to get an idea of the pass rate, so we can term number four as rates, but really get a good idea of the pass rates for the board examination. Most programs freely post this information as you're going through the process. You go online, you're searching for these programs. But you really want to know if the program is preparing students to be able to pass their board examination. Okay, passing the boards is one aspect of it, but also going a little further, being able to actually practice based on what the foundation of the program has really been able to teach is really important. Okay, the last thing I'll talk about is sort of the online learning format. That is something that's important. This gets more into your individual preference, but there are programs that have synchronous versus asynchronous learning. Synchronous, of course, is a little more structured where you actually have meeting times. You are not on as much of a self-paced program, but I will say that some programs have a hybrid of these things. So you want to get a good idea of what you may have more inclination to respond to in terms of how you learn best. Okay, I touched a little bit on this on the previous video, but you really want to kind of think about you as an individual learner and which style may actually fit you best. Okay, along the lines of the online learning format, I do want to also talk about a little bit, this is sort of a pocket here, but clinical sites, I know that goes without saying. I did a video just on this before, but you really want to see if the program is prepared to be able to offer you any resources around clinical sites in your state. Okay, the good programs have actually vetted these places out, and they are able to really showcase the programs or the preceptors that are valuable, that provide great experiences for their students. Those that have not done this ahead of time, you do want to kind of think about sort of a red flag as to whether the preparation that you are looking for is going to be there. Okay, so do ask about whether clinical placement is structured, whether there's a list or at least a list of resources to start with, because usually those more valuable programs, the good programs, are actually vetting these places out, and they're looking to be sure that what they're teaching is also in alignment with these sites and the preceptors that they seek out. So those are just a few points that I wanted to make. I think it's timely. Some of you may be right at the point of going ahead and registering and trying to apply for courses, and just kind of getting a good gist of what's expected. But again, focus in on these 5 things. Be sure that this is just a start to really kind of gauge the value of the program. There's so many out there, as I mentioned before, and hopefully this will help you to kind of identify and tease out which programs may be most appropriate for you. Okay. If there's anything that you guys, if you've been through this process before as well, and you think that there is anything else you'd like to add to this to help others who are pursuing this route as a PMHNP, applying to programs, please feel free to message me or comment below. I'm always open to feedback, always open to everyone's really experiences. I think it helps us all. So feel free to comment below, and I look forward to seeing you guys in the next video.